Hi everyone, I'm Dr. Satya Prasad Balki from True Vision Eye Hospitals. Topic of discussion today would be cataract surgery. Cataract surgery is one of the most common procedures being performed worldwide, and since the advent of lasers, it has become a very easy and a daycare procedure, so to speak, right now. Here, I'd like to talk to you about the lens selection, which is a very important element of cataract surgery. So, the understanding of cataract surgery is when the natural lens of your eye starts to degenerate and become opaque. That's when, during the surgery, we remove this lens with laser, we melt it away, and in its place, put an artificial IOL or intraocular lens. Now, these intraocular lens come in various types and models and different specifications also. So, how do you go about selecting the lens which is most suitable for you? First and foremost, the most common type of lens being used is called a monofocal lens. Now, in a monofocal lens, usually it is preferred for patients who are having a sedentary and retired life, older age group, and who have some systemic conditions which have affected the retina or the nervous system of the eye, namely diabetes, hypertension, etc. If the nervous system or the retina of your eye is damaged, your doctor would usually prefer a monofocal lens. Now, in monofocal lens, your distant vision would be corrected up to 95%, but your near vision, you will be requiring glasses for that. Another type of lens which is more in demand right now is called the multifocal lens. Now, in multifocal lens, you don't need to wear glasses after implanting this particular IOL. The reason being, this IOL has your distant and your near vision within one lens. Previously, it used to be called bifocal because it used to have your distant and near vision. Now, since there's a lot of screen time and people are more hooked on to their digital devices, the lens has taken a leap and become a trifocal lens, wherein your distant, intermediate, which is your screens, and your near, books, etc., all these three visions are covered. Patients are very comfortable with this lens, and the reviews and the results after the surgery are also fantastic. One disclaimer here, or the side effect you might have with the multifocal lens is, because this lens has both your visions in one lens, it has it in the form of multiple rings. So your distant and near vision are imparted into the lens in the form of rings. So whenever you are driving, there are very few occasions, maybe when there are no street lights, and in one particular angle, when light hits this particular ring, you might have a glare, that too for a few, probably a fraction of a second. Another thing is, because this lens is thicker than the usual lens, contrast sensitivity is reduced. So the ambient lighting in the room should be a little more than regular, so that it helps you in better reading. Apart from this lens has been beautifully accepted by patients, and the results are also fantastic. Another lens is called, which is latest again, is called EDOF lens, which is extended depth of focus lens. In this particular lens, it is one step higher than monofocal and one step lower than the multifocal. In extended depth of focus, this particular lens, you won't need to wear glasses for your distant vision, but your near vision will be corrected up to 90 to 95% here. So for the remaining part of it, you might want to or need to wear reading glasses. Other than that, EDOF lens, extended depth of focus lens, also gives a very good result. This lens can be used by patients who are again in the older age group, and also in the active age group, who are okay with using just reading glasses. Another thing about lenses here is you have different coatings also. Now, there's a lens is usually clear, or it comes in a yellow chromatophobe coating. So this yellow chromatophobe is coated and gives the lens a little yellow tint, because this particular chromatophobe protects your eyes from the UV rays of the sun. So whenever a patient comes to me with a cataract surgery, I always have a free and frank discussion about all the different lens types with them, and I encourage my patients to come back to me with questions regarding this lens, because once we decide on the lens, we have to understand that the lens implantation is permanent. So always make sure that you have gone for the right kind of lens for yourself. So because once the lens is fitted into the eye, it is very difficult to replace it or exchange it. So always take a right decision when it comes to your lens.